So in this video, I'm going to show you 5 different decompression exercises that you can do to unload the discs that are in the neck, which may relieve tension in your neck, headaches, pain into your shoulders, and even down into your arm. And if you'll stick around to the end, I've got a trick that I can show you that I use all the time that can instantly relieve the tension that you feel in your shoulders, and oftentimes it can reduce the amount of pain that you feel into your shoulder and into your arms and into your hand. So let's get started. Hey, I'm Dr. Paul Barnwell, chiropractor in Katy, Texas. I've been in practice for 10 years, and what I notice often is that patients think that they're under the impression that when you have a disc injury or you have the pain that's running down your arm, it was from a single instance where you may have turned the wrong way and it blew that disc, or the disc herniated, or whatever it was, you started developing these symptoms. But the truth is that it was something that was brewing for a long time before that happened. Because in normal life, if you turn your head a certain way or if you're under a certain amount of stress, your body's designed to be resilient against those things. So it's really an accumulation of stress, poor posture, micro injuries over time that load that area and cause it to break down to the point that it becomes injured, and then you express symptoms. So symptoms are really the last thing to show up. And when patients are under care, often symptoms are the first thing to go, which is a great thing, and then it takes stabilization after that. So that being said, as you're doing these exercises, it's important to know that you may notice a little bit of relief. Some people may notice a lot of relief, but what's important is that you do them continuously, because that's how you build a foundation, you build a base so that you can continually improve. That being said, if you're somebody who was in a major trauma recently, or you're having worsening or increasing symptoms in terms of severe neurological symptoms, increased pain, if you're having muscle weakness into the arm, if you're losing the ability to use your arm, you need to go get evaluated by a healthcare professional. None of these exercises should cause pain to be worse. If they do, then that's a sign that you shouldn't be doing them, or we need to modify them so that they work for you. Now, just like I stated before, it's important to know that most of the time with most patients, it's a chronic degrading that puts you in a situation where you develop these symptoms. And so when you're doing these exercises, we want continuity going forward so that you can slowly improve and build that foundation. And so as I show you these exercises, you should really try them in the order that I show you, because that's where you're going to get the best results, and they're designed to stack on top of one another. That and the best results are going to be the people who do it every day. These are designed to be simple and to take you very, very little time whatsoever. So that being said, let's get started. Okay, so number 1 is a posture reset. Now, before I show you this, I think it's very important for you to understand 2 things. 1, the spine and really any joint in your body, for it to be healthy, the requirements are that it has to be able to move in its full range of motion under resistance every single day. Joints like this were made to move. The second thing is the alignment. So we have specific alignment in our spine that reduces the load that's on each of the bones or the joints and the facets that are in the spine. And we're all cyborgs now, so we have our phones and our tablets, and we're sitting at work all day like this, and over time that loads the joint, and then we end up with destabilization of the spine, as well as things like this, which is this bulge here. So head goes forward this way. It's going to put the pressure here that pushes the disc backwards here, and that's when we end up with big problems. So by doing this posture reset, what we're trying to do, bring the load back over where it should be, which is going to take tension off of this area here. So let me show you that. Okay, so for this exercise, you're going to need just a stable surface, a wall just like this, and you're going to put your feet about a foot forward off the wall, and you're just going to put your backside on the wall. So you want your hips on the wall. That's step 1. Step 2, let's put our shoulders on the wall like this. Step 3, our back is rounded here. We actually want to roll that backwards by squeezing our tummy here and our glutes here. That's going to pull this direction, flatten our back, make sure your shoulders are still flat here, and then the head's going to go up against the wall. Okay, this is like phase 1 of this exercise. If this is all you can do, this is good enough. It's just about these small changes, okay? So we're going to hold this for 20 or 30 seconds. If that's great, if that's where you want to stop, that's fine. If that's too easy, then the next level is where we're going to put our elbows up against the wall, and then we're going to raise them up like this, okay? And so as you do that, what you may notice is that your hips may want to come forward. So they may want to come off the wall like this. So we want it flat, come off the wall like this. So as you're resetting, we want to put the elbows here. If that back comes off the wall, then we want to push it back towards the wall, okay? Squeeze your shoulder blades back, make sure everything's flat. And then for some of you, this is where you need to stop, and that's okay. And so you're just gonna hold it. Step 3 would be to slowly rotate these up, and you'll notice this is where it gets hard. So always be checking, is my head, shoulders, back, and hips against the wall? If not, then you need to stop where you're at. This is not about, it's not about pushing it too hard. It's not about, it's not like getting the final rep. It's not working yourself to failure. We're just creating a neurological reset and getting a little bit of muscle work in. So again, we're here and try and come here. Now, if this is great, for most of you, it's probably not. It's probably exactly where you need to be. And so, but if it is, then we can try and get the hands all the way up to the wall. And for most of you, you'll notice that the back has to come off the wall so that our shoulders come back and down so that you can actually do that. It's not gonna do you any good doing that. So we wanna just hold it where you're capable of holding it and just work that. Now, you're only gonna be able to hold that so long before you get fatigued. And so we're just gonna rep through it slowly. So just arms down, good. Find that posture and then bring it back up. Check, make sure everything's in line, and then bring it back down. And it's that simple. So you need to be doing that for 20 to 30 seconds, multiple times a day. It's not about fatiguing all the muscles. It's just about getting the neurological input to tell your brain and your body that it needs to be in this posture. And the more you do it on a repetitive basis, the more that you're gonna be able to hold that position, the more there's gonna be load taken off of your spine, the better you're gonna feel. So that's number 1. Let's move to number 2. So here's number 2. We're gonna do a chin retraction exercise. Now, if you've been on YouTube or anywhere else on the internet, you've probably seen these, but I wanna give you the understanding behind it. People have told you that having a strong core is very important, right? So if you have a weak core, what happens? You end up with back pain, you end up with all kinds of problems. But when we think core, we tend to think core, but really the core is the spine. So it's gonna be all the way up the front, all the way down the back. And so when we're in poor posture, on the computers, on the tablets, looking down all the time, then we end up here. That causes this part of our core to get very, very weak. So we want to exercise that. And so the chin retraction is a great way to both work the deep cervical muscles here, kind of like the abs for the neck. Don't worry, you won't get six-pack here. And then it's gonna align the spine back where it needs to be. And then I'm gonna add a little piece to this that may feel really great and get you some relief as well. So first part of the exercise, okay? So if you're standing here, you can do this up against a wall. You can do it all kinds of different ways. You can actually do it while you're laying down. I have other videos that show that. But we're gonna go, you can see my side profile here. If the head's forward like this, what we're working on is actually working these muscles. So I want you to really focus on using these. The point is not just to get the head back, it's to utilize the correct muscles. So if you have to, you can touch these muscles here and you can feel them working. Okay, so we're gonna pull our chin back. And essentially what's happening is we're stacking the spine here and we're utilizing these muscles to keep us in that position. Okay, you should feel it here. You can actually hear my voice changing because of it. Okay, and we're gonna hold that for 20 seconds. Okay, even better if you do that while your shoulder blades are pulled back. A lot of you have rounded shoulders like this. So when we do this, you may not even be able to get full use of these muscles. So we want our posture to be up straight, shoulder blades back and down, and that'll free up this range of motion so you can get back into that position. Okay, hold it for 20 seconds. You can do sets of 10. If it's too sore, if you start feeling symptoms from it, then you want to stop that. Okay, the next part, we're going to turn that from an exercise into a stretch. And so we're going to keep our shoulder blades back, keep this here, and then we're just going to gently use our finger or our hand, and we're going to push our neck up. So what this is doing, so we're working these muscles. These muscles get very, very tight. And so it's gonna feel really good and relieving to load this and then push this up. Okay? Now, again, if you experience increase in symptoms, you wanna stop immediately. It's that simple. Okay, so for number 3, this is for the shoulder blades, your scapulas that are back here. They play a huge role into how far forward your head's gonna move, and so we wanna fix that. Just like we worked here, and we mentioned that this was important, now we're gonna work that. So for this one, you will need some kind of stretchy band. I just have this one. This is like a pull-up band, a resistance band. You can use any kind of TheraBand that you have. You can get them on Amazon if you'd like. but what we're gonna do is we're gonna make it about this length, so shoulder width, okay? And so for the first one, we're gonna put this one right below our elbows here. So right here, okay? And so you're gonna need a wall for this, but I'm gonna show you first. What we're trying to do is bring the shoulders back, and then you're gonna open this up as wide as you can, okay? And then as we're on the wall, we're basically just gonna slowly slide up the wall. And what you'll notice is that your arms are gonna wanna start coming in like this. We're fighting that. So shoulder blades back and down. We're gonna go up as high as we can, and then we're gonna come down as far as we can. Again, make sure that the chin is gonna be over the shoulders. I'll turn around and I'll show you how to do this, okay? So if you can see, I'm gonna come real close to the wall here. Same as before, about a foot away. And so I'm gonna get as wide as I can here, arms down low, and then we're gonna work it slowly going up the wall, just like this. It doesn't really matter how fast or slow you do it. Slower is typically better, because then you're gonna be recruiting muscles that you're not used to. You may even feel some shaking, and that's okay. That's your brain trying to find out how to use those muscles properly, okay? And so my suggestion here is that you're gonna do this exercise 1 rep for time. So you're gonna put a timer on for 30 seconds, and you're just gonna keep doing it. And as you go along, you'll see my arms are trying to come in. So we wanna come out this way, and then bring it down, okay? So I wanna give you that one, and then there's actually one that I like that's a little bit more difficult, and these are called spiders. And so now the band is gonna come down this way. So what this does is it increases the leverage that's against you. So instead of it being a shorter lever, it's a longer lever. It's gonna be harder, but it's also gonna transfer the force from back here in the shoulder blade to more of the backside of the delt that's right here. So, which is highly neglected when people are working out. So I'll show you this. So it's gonna be the same thing, except for now we're using spider fingers, just like this. Okay, so as wide as we can get them. You may have to step a little away from the wall, and we're just gonna crawl up the wall like this. As your hands try and come in, you wanna fight that. And we're gonna put a timer on for 30 seconds, and you're just gonna repeat this exercise. Such a good exercise. You'll start feeling it burn pretty quick. So give that a shot. That's number 3. So this is number 4. This is gonna help with those rounded shoulders in terms of posture, so that we can reduce the pain that's in your neck. So often when we sit for too long and we have poor posture, these big muscles that are down here, they're called your lats. They actually do a big job, but they come up and they actually wrap around the front of the shoulder. So when they're chronically tight from sitting too long, they actually pull us forward. So what this is designed to do is to stretch that out so that we can regain, take pressure off of that muscle so that you can actually stand up taller. So this is, you're gonna need something soft to put your knees on, because you're gonna need a chair or a table or a stable surface. And so this is very simple. You're gonna love this one. So we're gonna get close to the table, and you're gonna put your arms on the table like this. Put your palms flat, just like this, shoulder width apart, and you're gonna lean back and try and get your head through your shoulders, okay? So you should feel a nice stretch that's right here. It's gonna get some extension in your spine, and you're just gonna hold that for 20 to 30 seconds and then come back up. If you're hurting your shoulders, then obviously you don't wanna do it. If you're increasing symptoms, you don't wanna do it either, okay? Now if you wanna increase how much of a stretch you're getting, you can include the triceps here. So instead of putting your palms flat like this, we're just gonna put those behind our head, and then we're gonna do the same thing, pushing our head through our shoulders just like this. And that'll help the shoulders to not be so rounded. So this is number 5, and this is one of my favorites for fixing rounded shoulders and just generally forward flexed posture. By doing this, you can take pressure off of the discs that are in your neck and your back, so that we can reduce those symptoms. I put this as number 5 because you're gonna be laying on your back, and sometimes if you have a disc issue and you get into that horizontal position going backwards, it can irritate it, and so you wanna be aware of that, and if that's the case, then don't do it. But what you're gonna need is, you can do this on the ground, you can do it on just a stable surface, and you're gonna need a foam roller, which you can get on Amazon or Walmart. And then you're gonna need just something to hold on to. So if I'm using this table, I'm gonna use the edge of the table. If you're on the ground, you can use the edge of the couch. If you have some dumbbells or something, you'll need that to kind of stabilize yourself. It's not absolutely necessary, but it really helps. And so what you're gonna do is you're gonna make sure that this is gonna be horizontal on your back. So it's gonna be like this, but on my back side here, okay? And it's gonna go right at the bottom of your scapula, so the bottom of your shoulder blade, which for most of you is gonna be, if you see your bicep here, right where the bicep, if you hold your arm like this, right where the bicep balls up, so you'll feel the tendon. So right here, right along your back is where the bottom of your shoulder blades are gonna be, and so you wanna position it right there. So I'm gonna get in that position, then I'll show you what to do after that. So we're here. Okay, right at the bottom of my shoulder blades there. And so if you get in this position and you're starting to feel radiating symptoms, then you need to stop. So, but for now, if it's feeling good so far, let's continue. And so what you're gonna do is you're gonna raise your arms over your head and you're just gonna lean back, okay? So you notice my knees are bent. That's a good starting position. I'll show you how we can improve this stretch in just a second. But I'm gonna roll backwards, I'm gonna lift my hips, and I'm actually gonna grab the back of this, and then I'm gonna allow my hips to sink back down. That's gonna give me a good stretch here. Just like that. Okay. Now, if you want this even more powerful, as you're in this position, you can lower your legs down, which is going to get a stretch all the way down into your hip flexors here. And you'll just hold that for 20 or 30 seconds. That feels amazing. With this one, you may need a partner. But oftentimes when you have disc issues at C5, C6, wherever those nerves travel down into the shoulders, the traps, down to the arms, it'll irritate those muscles and it causes these trigger points to lock up if it's been left there for too long. So I'm going to show you how to release those. Most of you will feel a pretty significant improvement. It may be short-lived until you get the actual problem corrected, but at least it'll get you some pain relief. So what you want to do is you'll start on the trap muscle here, which is the top right there. And you're just going to, I'll give you two ways. So if you don't have the grip strength for this, then you can use an elbow. But essentially, you're going to look for a knot in the shoulder, and almost everybody has some form of knot here. And you're just going to put some pressure down on it. Now, it's going to be tender, so you don't want it to get above about a 7 out of 10 in terms of discomfort, but it'll be worth it. So you want to make sure that you're breathing. So take deep breaths. Awesome. This is Dr. Horn, by the way, if you want to say hi.
Just beef.
And so as you grip this muscle, you're trying to pin it in place, and then you're going to have, if you're the patient, yep, you're going to lean your head away from it, and then you're going to slowly come back and go towards it. Good. And then go back the other way, nice and slow. And you'll do 5 or 6 reps, and you'll actually feel it start to release. So that pain will come down. Good. So the trap up here is the most common one. Now, what you can do is you can get an elbow. I like the grip one better because it's going to be more effective. But again, if grip strength is not your strong suit, then you can use an elbow. So you just find the same area and you're trying to pin it down. It's not going to pin as well. Oh yeah, right there. You can actually see me slipping off of it. Good. And oh. There we go. Good. You doing okay?
Yep. Okay.
Awesome. Good. So that's the trap. Another area that it may be bundled up is, so you have the trap that's right on top here. So right there. Right below that is a muscle that goes down and into your shoulder, and it's called the supraspinatus muscle. And so you're actually going to go under the big trap muscle here. Dr. Horn's got big traps, so it's easy to find. And then right underneath, usually towards the shoulder, you'll find another one. Good. And you're going to do the exact same thing. So lean to your right, and then lean to the left. Good. Alternatively, you can actually move the arm up. So what I'll have you do, Dr. Horn, is just like this, nice and slow. Good. So pin it down, and then go for it. And then nice and slow down. Perfect. And of course you want to do both sides. So it's going to be, you're going to hold it for a good minute or so. You're going to have them go through somewhere between 6-10 reps, nice and slow. And what you're trying to do is just hold that ball in place so that the rest of the fibers around it will stretch. And as you deprive that knot of oxygen, it'll release, it'll give you a lot of pain relief. So try that and let me know how it works. So you now have a simple framework that may help reduce compression in your neck and calm irritation to the discs and the nerves. Give these exercises a try and tell me in the comments which one gave you the most relief. Was it the chin tuck exercise or one of the traction moves? If you got value from this video and you found the exercises gave you relief, like and share this video so more people dealing with neck pain and arm symptoms can find safe, practical strategies that may help them too. Subscribe to my channel if you want to better understand your body, reclaim your health, and get practical, actionable steps you can use right away to move towards a life with less pain and more purpose. Now, there are likely daily movements and habits you do without thinking that they may be aggravating your neck or irritating a pinched nerve. I made a video that breaks down these daily aggravating movements. You can improve and heal with the exercises I showed you, but not if you keep repeating the same aggravating symptoms. Go watch this video next so you can identify what to change and avoid undoing the progress you're starting to make.